One challenge of point-of-care ultrasound, especially when viewing intra-abdominal organs, is having that image obscured by bowel gas. I often say that the two enemies of ultrasound are bone and air, and I say that because when you're doing a fast exam or an aortic exam, shooting through the ribs will obscure your views of the right and left upper quadrants, and bowel gas will often obscure your views of the aorta. However, this is not completely accurate, of course, because we use air and bone in different types of scans. Air is 100% necessary when you're doing a pulmonary exam, for example, or if you're evaluating an abscess and you're concerned for necrotizing fasciitis. And we use bone in our MSK scans all the time, looking for fracture, joint effusions, and dislocations. However, when it is critical to get a good aorta scan of a patient, then bowel gas can be your enemy. So let's talk about what are some strategies to overcome that. First, take a look at this image. There's interluminal air within the bowel that totally obscures our ultrasound image. It causes this dirty shadowing, and what's happening is the ultrasound waves are hitting the air molecules, are getting scattered all over the place, and we can't really tell what's going on. The first strategy is to push harder. I often see trainees trying to use the minimum amount of pressure when examining patients, and I understand their concern if you're looking for a AAA. However, it's important for us to get this diagnostic test, so apply an adequate amount of pressure. Push that bowel gas away and limit the distance between the ultrasound probe and the thing you care about in the abdomen. Next, use your acoustic windows. What is an acoustic window? That is something that allows you to get a great ultrasound image. So if you're not getting the image that you want, change the position of your probe, try shooting through a good acoustic window such as one of the organs or the bladder, and you may get the image you want. A third strategy is to change the position of the patient. We've all been in the operating room and seen how the surgeons will use Trendelenburg and reverse Trendelenburg to change where the bowel is lying within the abdomen during surgery. Use this to your advantage. Be creative. Use Trendelenburg and reverse Trendelenburg and maybe use one of the lateral decubus positions. Try all these techniques next time, and I think you'll have great success.